Have you ever felt like your legs weren't listening to you anymore? One morning, Bill, 68 years old, who lives in Florida, said he had to use both hands to support his knees to get out of bed. Every step felt like someone was driving nails into his knee joints. His hands felt numb, as if someone had tied a rubber band around his wrist all night. He used to think it was just old age, but after a fall in the shower, he was truly scared. According to a recent survey by the American Institute for Geriatric Medicine, more than 72% of people over 60 said they often had joint pain, and nearly 60% felt numbness in their hands and feet at least a few times a week. What's worrying is that most people think this is normal and don't do anything to change it. But did you know? Some doctors have revealed that the way you eat every day is secretly harming your joints and blood vessels. So what's going on in your body? At age 60 and above, the cartilage tissue, the cushion between the two ends of the bones, gradually loses water and mucus, causing the joints to dry out, crackle, and become inflamed. The small blood vessels that nourish the fingertips and toes also become narrow, making it difficult for blood to circulate, causing numbness. Surprisingly, many people who live to be over 90 years old in Japan and Italy have shared that they do not use anti-inflammatory drugs, but eat the right foods to support their joints and circulation. They choose dishes that have anti-inflammatory properties, lubricate joints, and increase blood flow from the inside. Below are 10 dishes recommended by doctors, which you can easily add to your daily menu. 1. Salmon, anti-inflammatory, protects joint cartilage. Dr. Richard Freeman, a geriatric internist from the Mayo Clinic, said, omega-3 fatty acids in salmon are not only good for the heart, but are also extremely powerful natural anti-inflammatory agents. It helps relieve knee pain and improve joint flexibility. A study published in the journal Annals of Rheumatic Diseases found that people who ate fatty fish at least twice a week had a 43% lower risk of developing stiff joints and rheumatoid arthritis. Easy tip: grill salmon with a little lemon and olive oil, and eat it with steamed vegetables or soup 2 to 3 times a week. 2. Spinach cleans small blood veins, helps to stop numbness in hands and feet. Spinach contains lutein, vitamin K, and magnesium, a trio of nutrients that are extremely beneficial for blood circulation and reduce microinflammation in nerve endings. Dr. Elizabeth Marks, a clinical nutritionist in New York, shared, just 1 bowl of spinach a day can help improve peripheral blood flow, especially in the hands and feet. In addition, spinach is rich in iron, which helps nourish red blood cells and deliver oxygen to the toes and fingers. Easy-to-do suggestion: use spinach stir-fried with garlic or mix salad with flaxseed oil every day. 3. Chia seeds nourish joint cartilage and soften knee. Chia seeds are small but contain large amounts of calcium, magnesium, omega-3, and soluble fiber, which are essential nutrients for people over 60 years old. Many people who live over 100 years old in blue zones, such as Costa Rica and Greece, have the habit of eating chia seeds every morning in cereal or yogurt. Chia seeds help reduce friction between the ends of bones, while stabilizing blood sugar and providing antioxidants, important factors to prevent joint inflammation. Simple way to use: mix 1 to 2 tablespoons of chia seeds into unsweetened yogurt or morning cereal. 4. Fresh ginger, a natural pain relief for joints. Ginger not only warms the stomach, but also inhibits inflammatory enzymes, according to a study by the University of Miami. Dr. Alan Roberts, a bone and joint specialist in California, said, ginger has the ability to reduce knee pain equivalent to ibuprofen if used regularly through food. Especially for people with morning stiffness, drinking warm ginger tea helps blood circulate better, softening connective tissue around the knee. Effective way to use: use sliced fresh ginger. Boil warm water to drink early in the morning, or combine with fish and meat when cooking. 5. Avocado, a lubricating oil for bones and joints. Avocados are rich in monounsaturated fats, which help reduce inflammation in joints and contain a lot of vitamin E, a powerful antioxidant for joint and muscle tissue. A study from UCLA University shows that people who eat half an avocado a day can significantly improve their blood inflammation index after 6 weeks. In addition, avocados are rich in potassium, a mineral that helps maintain water and electrolyte balance, helping to reduce numbness caused by circulatory disorders. Common uses: make unsweetened avocado smoothies, spread on whole wheat bread, or eat with green salads. 6. Beets expand blood vessels, improve circulation to the tips. Beets contain natural nitrates, which when entering the body will be converted into nitric oxide, a compound that helps dilate blood vessels and improve blood flow throughout the body, especially the lower limbs. Drinking beetroot juice 3 to 4 times a week can improve circulation to the limbs in older adults within 6 to 8 weeks, explains Dr. Joseph Chan, a cardiologist at Stanford University. A study in the journal Hypertension also noted that beets help reduce blood pressure, increase oxygen supply to joint tissue, and reduce the risk of capillary blockage. How to use: fresh beet juice with apple and lemon, or boil beets, thinly slice and eat with salad. 7. Walnuts, anti-inflammatory and protecting peripheral nerves. Elderly people are often prone to numbness in the limbs due to peripheral nerves being deprived of blood supply or microscopic damage. Walnuts contain alpha-linolenic acid, a plant omega-3, which helps protect nerve cells and reduce inflammation in the nerve roots of the back and neck. Neurologist Carla Jenkins from Johns Hopkins said, "We found that patients who ate walnuts daily had a significant reduction in peripheral neuropathy after 3 months." In addition, walnuts are also rich in magnesium and vitamin B6, 2 important substances in regulating nerve signals and supporting small blood vessels. Simple suggestion: eat 4 to 5 nuts a day for breakfast, or mix them into oatmeal or salad. 8. Turmeric reduces swelling, reduces joint stiffness, improves walking function. Turmeric is a golden spice in supporting arthritis. The main active ingredient of turmeric is curcumin, which has been proven to be a powerful anti-inflammatory, inhibiting cytokine molecules that destroy cartilage tissue. In a 12-week study in Italy, the group of arthritis patients who took curcumin every day had a 58% reduction in pain and more than twice the flexibility of the joints compared to the control group. Dr. Daniel Miller, an orthopedic doctor in Denver, said, "I recommend turmeric to many older patients, and many of them say they see a difference after just 2 weeks." Effective use: drink turmeric honey tea in the morning, or add turmeric powder to soups and stews. 9. Garlic cleans blood veins, prevents small blood clots causing numbness in hands and feet. Garlic is known as a natural antibiotic, but few people know that garlic also helps dissolve blood fat and reduce plaque buildup in the blood vessel walls, thereby helping blood circulate more easily to the lower and upper limbs. A recent survey by the Boston Nutrition Institute showed that people who eat garlic at least 4 times a week have a 37% lower risk of peripheral capillary blockage. In addition, allicin, a compound in garlic, also helps prevent the formation of small blood clots, which is a silent cause of numbness in the hands and feet in the elderly. Easy to use: eat roasted garlic or minced garlic, leave it for 10 minutes, then mix it into the dish after cooking. 10. Soybeans regenerate cartilage and nourish joint tissues. Soybeans contain isoflavones, plant compounds that have a mild estrogen-like effect, helping to protect and maintain the thickness of cartilage tissue, which is especially important for postmenopausal women. A study from Japan on 1,200 women over the age of 60 showed that people who regularly eat soybeans have higher knee cartilage density and less pain than those who eat them less. Dr. Helen Russo from Harvard School of Public Health emphasized, soybeans are a valuable vegetable protein that helps nourish joints without causing increased blood fat like red meat. Suggested use: drink unsweetened soy milk, eat tofu stir-fried with green vegetables or mixed in salad. Why do doctors advise the elderly not to eat according to their preferences if they want to completely eliminate joint pain and numbness in limbs? Many people think that as long as they eat enough meals and don't skip meals, their bodies will adjust. But geriatrician George Simmons at the Cleveland Clinic believes that after age 60, the way you eat every day is a silent medicine or poison for your joints and circulatory system. He once met a patient named Martha, 72 years old, who had been suffering from knee pain and numbness in her hands for 5 years. Although she still ate well, she often ate according to her younger habits: white bread, bacon, soda, and few vegetables. After Martha changed her menu to a low-inflammatory, high-vegetable diet, in just 2 months, she said she could walk up the stairs without holding on to the handrail. The problem is, the eating habits of older Americans often inadvertently aggravate arthritis and poor circulation by consuming too many foods that cause silent inflammation without knowing it. 3 common mistakes that make food lose the effect of treating joint pain and numbness in hands and legs. Mistake 1. Overcooking or frying in strong oil destroys anti-inflammatory nutrients. Many dishes such as salmon, spinach, and beets only work best when prepared gently, such as steaming, boiling, or lightly baking. Dr. Ruth Galler, a geriatric nutritionist in Oregon, shares, frying salmon at high temperatures oxidizes omega-3 south and destroys vitamin E, 2 important nutrients for protecting joints. Tip: always cook until just done. Prioritize steaming or lightly sautéing with olive oil. Avoid refrying foods many times. Mistake 2. Eating too much red meat, fatty dairy products, and refined sugar. These foods are all classified as silent inflammatory, increasing cytokines, factors that directly destroy cartilage tissue and compress small nerves. A study from Harvard Medical School found that people who ate more than 5 servings of red meat per week had twice the level of inflammation as people who ate more vegetables, beans, and fatty fish. Especially for people with numbness in the limbs, refined sugar in cookies, sweet cereals, or soft drinks can disrupt peripheral nerve signals by affecting the myelin sheath. Tips: cut down on sugar and red meat to a maximum of 1 to 2 times per week, and replace it with protein from beans, fish, nuts, and eggs. Mistake 3. If you don't eat enough good fats, your body can't absorb curcumin and fat-soluble vitamins. Some people eat turmeric, drink beetroot juice, or raw vegetables regularly, but still don't see clear results. Part of the reason is the lack of good oils to help the body absorb fat-soluble nutrients such as curcumin, vitamin K, or lycopene. Dr. Abigail Harris, an endocrinologist in Texas, emphasized, older adults should incorporate olive oil, flaxseed oil, or avocado into their meals to maximize their ability to absorb anti-inflammatory substances. Simple tips: mix olive oil into salads, add avocado to oatmeal, or sauté vegetables in canola oil. A story from a long-lived person. I used to be unable to squat. Now I tend plants all day. Henry, 91 years old, who lives in the Seattle suburbs, was diagnosed with stage 3 osteoarthritis of the knee. He couldn't stand for more than 5 minutes and often had numb hands at night that made him drop a glass of water. Instead of taking painkillers forever, he started eating salmon, drinking ginger and turmeric tea every morning, and adding spinach and garlic to every meal. After 6 months, he was gardening, taking afternoon walks, and no longer wearing a knee brace. Henry shares, "The doctor told me I needed a joint replacement in a year. Now I've changed the way I eat and changed my life." How to combine foods for smooth knee joints and nitrogen monoxide numbness in hands. Instead of eating each dish separately, Many doctors recommend combining the right food at the right time and in the right way to optimize the effectiveness. Here are 2 simple principles. Principle 1. One meal includes 1 dish rich in omega-3 plus 1 green vegetable plus 1 anti-inflammatory spice. For example, grilled salmon plus steamed spinach plus sliced fresh ginger. Principle 2. At least 1 meal a day has foods that promote blood circulation plus nuts that are good for the nerves. For example, beetroot juice plus walnuts with yogurt. Signs that your body is recovering after eating properly. After 2 to 3 weeks of following a diet rich in anti-inflammatory and circulatory supporting foods, many people begin to notice dramatic changes that they previously thought were impossible. Washington internist Alice Monroe says, "One of the things older patients often report is that they are surprised to no longer have morning stiffness, which is a sign that joint tissue is starting to regenerate and inflammation is reduced." 5 positive signs that you're on the right direction. 1. No more creaking when standing up or sitting down. As joint cartilage is regenerated and lubricated by omega-3s, vitamin E, and curcumin, the creaking sound between bones will gradually decrease, especially in the knees, wrists, and lumbar spine. 2. No more tingling in the hands when waking up in the middle of the night. This is a sign that blood circulation to the peripheral nerves has improved. Walnuts, beets, and spinach help dilate the small blood vessels that supply the hands, reducing numbness at night. 3. You can walk further without needing to rest. People over 60 often experience cramps or pain after a few hundred steps. When the joint is well supported, you will feel lighter in the knee, no longer swollen and tired as soon. 4. The number of times you take painkillers is significantly reduced. 1. Many patients report that after just 1 month of eating properly, they have reduced the amount of painkillers by 50 to 70%, and some have even stopped completely. 5. A feeling of flexibility when rotating the wrist, knee, or bending. This is a clear sign that the connective tissue around the joint is softening again. The synovial sacs are functioning well, and acute inflammation is reduced. Warning: signs you're still eating wrong, even though you think it's right. Many people say they've added fish, greens, and turmeric to their diets, but their joint pain or numbness in their limbs hasn't improved. Why? They fall into one of these common nutritional traps: eating the right foods, but preparing them the wrong way. Many people boil vegetables for too long, which destroys nutrients, or fry fish in industrial oils, which causes omega-3 south to turn into inflammatory compounds. Solution: use extra virgin olive oil, steamed vegetables, or grill fish at medium heat. 2. Unknowingly eating more joint-damaging foods every day. For example, drinking bottled sweet tea, eating cookies with refined sugar, or eating sausages containing nitrates. These foods increase inflammation in the blood, reducing the effectiveness of healing foods. A survey from Tufts University showed that people who consume more than 25 grams of sugar a day have twice the level of joint pain compared to people who consume less than 10 grams per day. 3. Eating too little. The body lacks the raw materials to restore joint tissue. Old people eat less because they are afraid of gaining weight. But if they do not eat enough protein, good fats, and minerals, cartilage tissue cannot regenerate, and blood circulation also decreases. Tip: don't cut back too much. Eat enough, but choose quality foods. Common questions from seniors and answers from doctors. Question 1. I have diabetes. Should I eat beets and avocados? Dr. James Porter, an endocrinologist in Michigan, sighed, "Beets have natural sugars, but only have a slight effect on blood sugar when eaten in moderation, especially when eaten with fiber or protein. Avocados contain good fats, do not increase blood sugar, and even help control blood sugar stably." Tip: eat about 1/2 beet at a time and eat it at lunch. Do not force yourself to drink too much at once. Question 2. I don't eat fish. What can I replace it with? Flax seeds, chia seeds, walnuts, or pure canola oil are all good sources of plant-based omega-3 south. DHA-rich eggs are also a good choice if you are not allergic. Question 3. Do you need to take supplements? If your diet includes enough vegetables, beans, fish, and nuts, you don't need any supplements, says nutritionist Mary Ellen of the Pennsylvania Geriatric Center. But if you eat irregularly, vitamin D, omega-3, and magnesium supplements can help. However, you should consult your doctor before taking any supplements. New eating habits, new life after 60. Many people think that after 60, they are too old to change. But the truth is, small changes in the way they eat can have effects that medications cannot. Foods like salmon, spinach, beets, turmeric, and chia seeds are not just food, they are healing therapies. And if you stick with it for a few weeks, your body will thank you with light steps, flexible hands, and a full night's sleep. Why do some people still have numb hands and joint pain despite eating a healthy diet? Not all joint pain or numbness comes from normal degeneration or poor circulation. Neurologist Harold Epstein at the Mayo Clinic warns, if you have changed your diet, slept enough, and exercised regularly, but still don't improve, your body may be warning you of a more dangerous disease. Eating right is the foundation, but sometimes pain is a symptom of a serious underlying disease that requires timely medical intervention. 5 red signs when pain and numbness are nitrogen monoxide longer due to age. 1. Numbness occurs on one side of the body, accompanied by muscle weakness or mild paralysis. If you experience numbness in one arm or leg, along with weakness, difficulty holding objects, difficulty walking, or difficulty maintaining balance, it could be a sign of a mini-stroke or damage to the central nervous system. The National Stroke Center in the United States says about 15% of people over 60 have had a mini-stroke but mistaken it for a normal limb fatigue. See a doctor immediately if numbness spreads to one side of the body, slightly crooked mouth, slurred speech, temporary blurred vision with numbness in the hand. 2. Joint pain with swelling, heat, redness, and swelling that lasts more than 1 week. If the knees, elbows, or fingers are red, swollen, hot, and painful, and do not improve with rest, this could be rheumatoid arthritis or gout, 2 autoimmune inflammatory conditions that require specific medications. Unlike normal degeneration, rheumatoid arthritis can deform joints if not treated properly, says Dr. Corinne Lopez, an osteopath at Johns Hopkins. Don't just rely on food. 3. Pain and numbness increase at night, wake you up, and spread along the spine. If numbness starts in the lower back, spreading to the hips, thighs, and calves, you may have sciatic nerve compression or spinal stenosis, which often does not improve with diet and requires intensive treatment. Experts at the Texas Spine Surgery Institute warn that many older people let pain persist, leading to permanent leg weakness or loss of mobility. 4. Numbness and tingling, accompanied by loss of hot and cold sensation in the limbs. If you can't feel the temperature clearly, or have a slight burn without knowing it, it is a warning sign of severe peripheral neuropathy, often seen in people with diabetes or long-term metabolic disorders. In this case, anti-inflammatory foods only help a little. You need to check your blood sugar, liver and kidney function, and nerve conduction. 5. General fatigue, unexplained weight loss, accompanied by joint pain. When joint pain is accompanied by persistent fatigue, poor appetite, weight loss, and night sweats, it could be a sign of a systemic disease such as lupus, polymyositis, or even early-stage bone cancer. Older patients tend to be subjective, thinking it's just normal degeneration. But if the pain doesn't improve after 4 to 6 weeks of lifestyle changes, a comprehensive checkup is needed. Tips for maintaining healthy eating habits for joints and circulation. Prepare 3 days of fresh food in advance. Freeze fish and tofu for easy cooking. Stick a weekly menu on the refrigerator to avoid repeating and forgetting dishes. Always have turmeric powder, fresh ginger, and olive oil in the kitchen to add quickly to any meal. Drink enough water every day because joints need water to produce mucus and stay flexible. Track your body every week, noting when your joints feel lighter, your hands stop feeling numb, or when you take less pain medication. A proper diet is a powerful weapon to help you fight joint pain and numbness in your limbs. But sometimes the silent signs are urgent warnings that need to be heard and checked. If you have tried to change your eating habits, but your body still does not respond as expected, it is not your fault. It may be time to combine nutrition with modern medicine to protect the healthy years ahead. If you find this video helpful, please leave a comment, share it with other seniors, because sometimes a timely video can save a life in danger.